Okay, so let's start. Good afternoon and welcome to all. Welcome to all on behalf of Ayush Department of Maharashtra University of Health Sciences, Nashik. Myself, Dr. Karle Gitanjali, Professor and Head, Ayush Department, MUHS Nashik. I request to all, please keep your mic mute. Okay. So we are gathered here for today's clinical meeting, and today's topic is osteoarthritis knee joint. To present case scenario, I would like to request Dr. Saili Bhog. She is PG scholar from GD Pol Foundations, YMT Homeopathic College, Mumbai. Dr. Saili Bhog,
Yes, ma'am.
please share.
Okay. Good evening to all of you.
Please share your PPT. Good evening.
Is it visible, ma'am?
No, no.
No.
There is a green tab in the inferior
Yes, ma'am.
bar. Your WhatsApp is visible now.
Ma'am, actually, I'll just share from there because from PC it is not showing. No, that's why.
So you are joining from mobile.
No, I have joined from computer only. But it is not getting shared. Is it share, ma'am?
No.
No.
Download and open that PPT in your computer, and then
Yes, ma'am, it is there in my computer. I'm just opening it through Microsoft PowerPoint only. It is open, but I don't know, it is not shared.
again click to share.
Again, I have to click to share.
You can take help from your colleagues or your friends.
In the house actually
Yeah.
alone. Okay. Now, ma'am?
Yeah, it is visible. Now there is a full screen mode or presentation mode. Click on that.
I'll start slide.
No, not that. Yes. Okay.
It is visible, ma'am?
Yeah, it is visible. Your audio is clear. Now you can start.
Okay. Good evening to all of you. Myself, Dr. Saili Vaibhav Bhor. I am PG Part 1 student from Repertory Department of Dr. G.D. Port Foundations, YMT Homeopathic Medical College, Kharghar. Today's my topic is a case scenario of patient of having bilateral osteoarthritis of knee joint. The short introduction about the osteoarthritis. As we all know, osteoarthritis, it remains the most challenging arthritis disorder with a high burden of disease and no available disease-modifying treatment in nowadays. Symptomatic early stage of osteoarthritis of knee urgently needs to be identified and defined as efficient early stage case finding and diagnosis in primary care would enable healthcare providers to proactively and substantially reduce the burden of disease through proper management, including structured education, exercise, and weight management when needed, and addressing lifestyle-related risk factors for disease progression. Case history of my patient. A 64-year male patient came with complaints of severe pain in both the knees approximately since 5 years. There is severe pain in both the knees, which is mostly aggravated by walking, by exertion, and by sitting on floor. Pain is better by rest, by massage, by hot fomentation sometimes. Complaints are more in winter season. There is stiffness of both knee joint in winter, mostly in the morning while getting up. In the past history, there was nothing major. Family history, there was nothing specific regarding the mother. His father died early when he was young, that is at 14 years of age. Personal history, appetite was good. Patient is having 3 times a meal per day. Thirst was also good, feels thirsty, takes about 2 to 3 liters of water per day. Craving specifically for non-veg. In non-veg, that is for chicken, milks, and sweet. Urine is also normal, stools are normal. Perspiration is also not as so much. Thermally, the patient was chilly. Sleep was very late in the night, around 2 to 3 a.m. and gets up around 8 a.m., feels fresh. Dreams sometimes related to work. Mental history. Patient was a retired police officer. I have just summarized my history. Patient was very responsible as from the childhood. As he told me, his father was died early, so he took up all the responsibilities. Patient was very disciplined, reserved, mentally very strong, but suppresses all kinds of emotions, never expresses as such. The patient was very time punctual, very serious kind of person, and intelligent. This was a knee X-ray. In 2016, when the symptoms started, the patient went to allopathic physician, and that physician told him to do the X-rays. So he has done the X-rays. That time there was no changes. Both the knees were normal. There was no significant abnormalities noted that time. Then a patient took some kind of allopathic treatment, and patient was okay for some time. Then again 2020, patient started with the again knee pain and back pain also. So the physician has advised him to do X-ray lumbar spine as well as both the knee. That time there was mild osteoarthritic changes in both the knee joints. That time also patient took the allopathic treatment itself. And in October 2021, that is post-COVID, patient again started with the severe pain. So this time the patient came to me, and that time also he did his X-ray and then he came to me. That time also the X-rays of both the knee joints were showing there is a mild osteophytic changes at the articular margins of the femur and tibia, and there is mild reduction in the medial compartment of the tibiofemoral joint spaces. So this was all about my case. Hello, ma'am, I'm not able to hear you.
Okay. Thank you, Saili. Was
Welcome.
nice. Now, for expert opinion regarding modern medicine and anatomy, I would like to request Dr. Archana Kalyankar. She is Associate Professor, Anatomy Department, Government Medical College, Aurangabad. Dr. Archana Kalyankar.
Thank you, madam. Myself, Dr. Archana Kalyankar. First thing, this is the first time I am attending such type of activity conducted by, maybe it was, many times it was conducted in.
Can you on your video?
Ma'am, am I audible here?
Yeah, you are audible.
Okay.
You are not.
It was, thanks for giving opportunity to give the expert opinion regarding this knee joint. We are teaching the students knee joint variant specifically from the UMUHS most common question to become in the exam also. And it was nice presentation of case. Only thing is that this knee joint, only I'm concentrating on few points that I have prepared some notes. Just I want to tell in front of you. Knee joint is basically, it is the synovial joint, condylar variety of synovial joint, and it is also you can call it a modified hinge joint. As it is having the fibrocartilaginous disc, that's why it is also called the complex type of joint. Means it is having complicated structure, that's why it is called the complex hinge and the modified hinge joint. Okay, And what movements are occurring at this is the flexion, extension, and little bit internal and external rotation. These are the main movements are occurring at the knee joint. And because of this complexity of the nature, and because of this movements which are occurring, locking and unlocking, there are possibilities of degenerative changes in the knee joint. And the osteoarthritis, this is especially degenerative changes. And another type of arthritis we are not taking here as the part, rheumatoid arthritis, but better if we compare this rheumatoid arthritis and the osteoarthritis, then we come to know very much detail about that. But this time knee joint, for that any joint, we should know that I'm not having can I share my this one diagram at least on
Yeah, you can share, ma'am. Yeah.
But I open it on the this one mobile. How to open it, I don't know.
Can you take help of someone?
No, I am at home now. It is, but can I communicate with the orally also? Same thing that many
Still not visible. You have not turned on your video.
Acha, huh. Okay. Start the video. It is not able, maybe unable to access camera privacy. Something is coming. Don't know why it is not opening.
Okay.
And I try. I don't know. Maybe on iPhone something. I don't know what is happening. But then it is difficult to show the slides also, isn't it? If it is not opening the camera, I don't know. Okay, only few points I want to tell. Knee joint, we know the what type of it is joint, and ligaments of knee joints are very important. Whatever ligaments are there, they are extended. This is the joint between femur and the tibia, and whatever ligaments are extending between tibia and the femur only. So we should know that what ligaments are there between the joint, or the which are forming in the joint. Main is the first menisci. Menisci, these are the fibrocartilaginous discs which are located in between the joint, that is between the femur and the tibia. In this also there is a medial and lateral collateral ligaments are there. Medial and lateral collateral ligaments are there which are binding the femur and the tibia. In that medial collateral ligament is also called the tibial collateral ligament. It is nothing but the adductor magnus degenerated ligament. And this ligament usually prevents the displacement of the femur and the tibia. And it is closely attached to the medial lemniscus. What happens because of its attachment with the medial meniscus, there are chances of tear when there is a lateral blow on the knee joint. There will be the chances of tear of medial meniscus and the anterior cruciate ligament and the medial and fibular collateral, medial or fibular collateral ligament. So first I will mention the what ligaments are there. Medial collateral ligament, lateral collateral ligament, medial meniscus, lateral meniscus, meniscofemoral ligament, and two cruciate ligaments are there, that is anterior and posterior cruciate ligament. In this, among the two cruciate ligament, anterior cruciate ligament is more prone for the injury. Similarly, among the menisci, medial and lateral menisci, medial meniscus is more prone for the injury. And why this is there? Because medial meniscus and the fibrous capsule, there is a no gap. There is a direct communication between the medial cruciate ligament and the fibrous capsule and the medial meniscus. But in case of the lateral meniscus, there is some gap between the capsule and the lateral meniscus. So it is very rare, or the rare injury is there for the lateral meniscus as compared to the medial meniscus. This is the one applied aspect. And another, what is the cruciate ligament? It is just what structure? These are the inside. These are all intra-articular ligaments are there. There means they are inside the joint cavity. These ligaments are there, and they are but extra synovial, means synovial cavity is there which is covering the knee, whatever articular area are there. There is a synovial cavity and containing the synovial fluid, and they are just giving nutrition also, and they are giving the support to the joint. And these menisci for doing any movements, that is whatever flexion is occurring at the knee joint or the extension or the medial or lateral rotation, these menisci act as a support to the knee joint. Also, the cruciate ligaments are there. They are also binding these two bones together. What will happen in degenerative changes, whatever this our related topic, what is that arthritis? What happens in the arthritis? We will directly come to that. We have seen the whatever menisci are there, what are the ligaments are there inside the joint. Then that cartilage which is covering the articular surface is the articular cartilage. And this articular cartilage is without the perichondrium. And the perichondrium is having the very vascular in nature, and that perichondrium is not having the vessels, and its nutrition is directly by the synovial fluid or the diffusion, which is from the synovial fluid, which is containing in the synovial cavity. Now, what is happening in the arthritis? That cartilage which is present or covering the articular surface, what happens to that? Degenerative changes. This is, we all know that it is the osteoarthritis means degenerative changes itself. But why degenerative changes? Usually age-related changes are there. For that, we should know what is osteoarthritis and rheumatoid arthritis. Usually osteoarthritis, distal in joints are affected, and these are localized joints, means single joint or many 2-3 joints are affected. But in the rheumatoid arthritis, there is a metacarpopharyngeal joint is usually affected. That's why osteoarthritis commonly occurring in the knee joint, Now, why there is a cartilage is there is because of the cartilage, loss of cartilage is there, bone is rubbing over the bone. This is the main cause of the osteoarthritis, means both is there and there is a no supporting cartilage which is giving the shock absorption or which is giving the support to the articular surface. Because of that, what will happen, these all in the joint, there is a rubbing of femur and the tibia over it. Whatever movement is occurring, because of that, there is a rubbing, is there direct bone over bone. And because of that, there is a degenerative changes occurs in the cartilage, in the bone, in the cartilage. And because of this, bone ends are destroyed. Rubbing of the bone is there over the bone. That's why there is because of this, there is a lot of pain occurs during active movement and during the passive movement also. When there is a passive movement pain, both in active and passive movement pain is occurring, that means there is an intra-articular problem is there. If there is only in active movement pain is occurring in the knee joint and not in the passive movement, then that means extra-articular problem will be there. Mean both causes pain in active and passive is different. Means in active and passive both intra-articular problem is there in the osteoarthritis. If it is only in the active movement pain is there, that means there is a extra articular problem is there. Now, why there is a pain? Because of rubbing of bone, one over bone, there is a pain is there. Then cartilage is lost, as why I told why there is it is covered by the articular cartilage and doesn't having the perichondrium. That's why there will be this loss, rubbing. Maybe many causes are there. That is the weight more usually idiopathic will be cause is there, or there is a secondary cause is there. Idiopathic, we don't know. Some patients are having the osteoarthritis and some are not having the causes. We don't know. And in this case, there is a localized, only knee joint is affected most commonly in aged groups. This common is more common. There is more tendency to occur in the degenerative changes. Then what happens because of cartilage is vanished and because of rubbing of the bone, there is a sclerosis occurs at the ends of the bones. Sclerosis occurs at the ends of that femur, articular area of the articular surface of the femur and the tibia. And because of this sclerosis, necrosis occurs at the bones. Necrosis occurs. Why necrosis? Blood supply is hampered at that time, and that's why necrosis occurs. And because of this necrosis occur, normally whatever dead part is there, there is a regenerative changes occurs, but that the regeneration is not occurs at normal rate, and that's why there are osteophytes occurs. That is compensated by the osteophytes. And these osteophytes occurs and these degenerative changes occurs. That's why there will be swelling, there will be deformity, and because of there will be decreased range of movement also, and there is a pain during the movements. That's why there is a range of movement is also decreased. But here difference is that osteoarthritis always differ from rheumatoid arthritis. There is a no inflammatory changes. This is the main difference. Osteoarthritis, no inflammatory changes, only degenerative changes. And that's why also why degenerative changes are there. These are because of the trying to get the normal regeneration, because of necrosis occur, because of rubbing occur, because of sclerosis occur. They are not at the normal rate at that age, and that's why there is a in trying of body to get the regenerated fast, and there will be osteophytes occurs. This is the main cause of the osteoarthritis. Thank you, madam. This is only few points I want to tell because it is related to that and clinical anatomy, knee joint, and why this occurring. I told you these are more complex joint because of there are chances of that knee joint is, and there is a, this is main weight bearing joint. This is the weight bearing joint and mostly is transferred weight. And we are not one thing I want to tell, many ladies they get aware of in 30s, 40s to go weight reduction and go for the gym, go for the any aerobic Zumba. And at that time, they are doing along with their trainer. Trainer is usually young age. What will happen? They are trying to do that movements, flexion, extension, internal, external rotation. Immediately they want to revert back. And that age doesn't allow them to do this immediately. And because of this, not doing movements properly at proper interval, and because of weight also gaining at that time and that producing pressure over the joint, this may be the one of the reason for the osteoarthritis at that age. If it is the not secondary cause, idiopathic or the unknown cause. Thank you, madam, for giving opportunity to give a remark on this topic. I tried to open the video, but not opening. I don't know what to do that.
Thank you so much, ma'am. Very well said that sclerotic changes, necrosis of articular surfaces at knee joint, then no inflammatory changes, only degenerative changes are there. Very well said. Thank you so much for clinical anatomy, ma'am. And now, for expert opinion from Ayurveda, I would like to call Dr. Santosh Swami. He is Associate Professor from Kai Chikitsa Department, Seth Govindji Raoji Ayurveda College, Solapur. Dr. Santosh Swami, sir.
Yes, madam. Good evening, madam. Good evening, one and all.
Good evening,
Am
sir.
I audible?
You are audible, sir.
Okay, thank you. First of all, I would like to thank you, madam, for calling me as an expert for this case presentation. Okay. Then I would like to add some points regarding Ayurvedic perspective in this case of osteoarthritis. According to Ayurveda, osteoarthritis means Sandhigat Vata. Okay, Sandhi means not only the Sandhi of bones, but according to Ayurveda, Sandhi means Sandhi of Snayu, Sira, Kandara. That is, the ligaments also involved are the main part of this Sandhigat Vata, or this the osteoarthritis. And there are the main important theory behind this Sandhigat Vata is that it is the disease of Tridosha, especially Vata dosha. Okay. Hello.
Yes, sir. Please continue.
Then according to the Ayurvedic theory, there are two types of Sandhigat Vata or Vata Vyadhi. It is the first one is the Dhatu Kshayajan or Nirupastambhit Sandhigat Vata, and second one is the Avrojanya or Marga Avrojanya. That is Upastambhit Sandhigat Vata. Dhatu Kshayajanya Sandhigat Vata means degenerative osteoarthritis, and Upastambhit or Marga Avrojanya Sandhigat Vata means inflammatory arthritis, just like rheumatoid arthritis, gouty arthritis, etc. But in this case of osteoarthritis, or as we called as a Dhatukshayajanya Sandhigat Vata, especially of the knee joint, there is there are such etiology behind the Sandhigat Vata of the knee joint, or osteoarthritis of the knee joint, or the Dhatukshayajanya knee joint, is that specifically there is the age, that is the Vardhakya, that is old age, the main factor responsible for the vitiation of the Vata dosha, that causes degeneration of the Asti and Majja Dhatu also. So that causes degenerative changes. Then also there are the certain substances which are responsible for the vitiation of the Vata. These are the ingestion or consumption of the dry, then rough type of substances, which causes vitiation of the Vata dosha, and which further causes vitiation of the, or the dushya of the Asti and Majja Dhatu, which causes degenerative changes. Then some accidental or agantuk causes also are there. Traumatic causes may be there. That's why it also may be due to the occurs due to the trauma also, external aghat, bahya aghat due to that. Then also atishram, or those persons who do much exercise or do much work, that is the laborers work or farmers, those are having tends to have more percentage, or more frequently they got disease like degenerative osteoarthritis. So atishram, that also causes vitiation of the Vata dosha, and then degeneration of the Asti and Majja Dhatu, or Asti Majja Kshaya is also called. These are the main positive factors according to the Ayurveda. And the Lakshana, or the signs and symptoms according to Ayurveda, are that Ayurveda has described that Vatapurna Dhrutisparsha Shotha Sandhigatyanale Prasarana Kunchunyo Pravrutischa Savedna. What is difference between the arthralgia and the arthritis? Whenever we get pain, that is joint pain, it is called as arthralgia. But when that pain allows us or not allows us to free our movements, that is called as the arthritis. That is there is a feeling like air covered in the bag, like type of swelling is there. Then there are the restricted movements, which are the movements, that is flexion, extension, abduction, adduction, rotation. These movements of the particular joints are restricted. That is the prasarana kunchanayo pravrutischa savedana. So we can say that this is the patient of Sandhigat Vata. Whenever there's movements are restricted, we call it as a Sandhigat Vata. Otherwise, it is only Sandhi Shula only. So these are the Lakshana. And according to the Ayurveda, Dhatukshayajanya and Margavarojanya, their Lakshana differs. Like in Margavarojanya, there are inflammatory conditions, rubeolar, calor, edema, just type of Lakshanas are present. Then according to Ayurveda, Araktavarna, Ushna Sparsha, Sparsha Sattva, these are the Lakshana, or the signs or symptoms which are present in the Upastambhit Sandhigat Vata. And in Nirupastambhit Sandhigat Vata, although there are it is due to the degeneration, but in the initial part of the disease, there is slightly inflammation also present there. So first there are inflammatory conditions, but rather last in their patient feels pain while movement, and at the rest he feels no pain. Okay. Then according to Ayurveda, this pain gets subsides after rest, and that's due to the Vata. Okay, Vata Prakopa, when we get Vishranti or rest, the Vata Prakopa also gets subsided, so patient get relief. Then according to the Ayurveda, there is also one theory that after Snehan and Swedan, that is oleation and sedation, this pain subsides in Dhatukshayajanya Sandhigat Vata. And if there is inflammation, we cannot give oleation, that is Snehan cannot be done, otherwise these symptoms get worsened. Okay. So these are the differential diagnosis. This is the differential diagnosis of inflammatory and degenerative osteoarthritis. Okay. So according to Ayurveda, these are there is a different theories are there, and according to that, treatment is also different. So the line of treatment, first of line of treatment may be there is a bahya upchar. That is the Kuryat Sandigate Vate Daha Svedopanahanam. That is the Daha means Agni Karma. Agni Karma is there. Agni Karma should be done. Swed means sedation should be done. And Upanaha Swed, that is the some sort of substances are heated, and then they are bound to the joint space so that their sedation may occur. Okay. So these are the specific procedures for the inflammatory conditions or the preliminary stage of the disease. If some type of inflammation is there, it gets subsided. Then along with the Langan and Pachan, there this type of treatment also to be done, so that if there is a improper digestion or the formation of the ama, so that ama pachan should also be get corrected. So Langan and Pachan should also be done in a preliminary stage of this Sandhigat Vata. Then after that, Brahan treatment, or there is a Snehan, Svedan, different types of Svedans are there, or different types of oils are there for the Snehan purposes, for just like Dhanvantar Tel, Sahachar Tel, Bala Tel, Kshir Bala Tel, Narayan Tel, Mahanarayan Tel. These types of oils are prepared from various plants, and these are applied over the in a joint externally. Then that's in the form of Janu Basti or Basti, it is applied over there for so that that oil gets absorbed at that site. So the Vata Shaman would takes place very properly. So this is also done there. That is the external oleation. Then Swedan, that is sedation type, various types of Swedan are there, just like Nadi Swed, then Patrapinda Swed, then Dhara Swed, Shashtishali Pinda Swed, as according to the from Ruksha to Snigdha, or from Shaman or Rukshan to Brahan type of the Swedans are present there. That should be applied according to the stages of the disease. Okay. Then there are some also procedures in the Panchakarma like Basti treatment. Basti is the main treatment for the Vata dosha. So Yoga Basti, Karma Basti, Kal Basti, or Anuvasan Basti, Neuro Basti type of enema should be given in that patient. Then there are some specific enema which are useful in the degenerative osteoarthritis, just like Tikta Kshir Basti. That the milk is prepared, or milk is heated with the Tikta bitter plants, churna, and along with the Mahatiktak, or against again that bitter plants are also, that ghee is also processed with bitter plants, and that Tikta Kshir and Tikta Ghrut is also administered in the form of enema. The theory behind this is that it gets absorbed in the Asthidhara Kala, or in the musculoskeletal system, and the specific absorption of the that enema takes place, and so degeneration is corrected with that type of enema, but it should be given in 21 days or 42 days, just like in that manner. So Tikta Kshir Basti is also to be given, or Majja Basti should also be given in the serious or traumatic type of osteoarthritis, where the meniscal tear is there, or that is the serious injuries there in the osteoarthritis, that should be done or corrected with the Majja Basti also. Then certain medications are there, just like Panchatikta Ghruta Gugul, which is also drug of choice in this type of osteoarthritis, or Nirupastambhit Sandhigat Vata. Then Gugul Kalpana, Yogaraj Gugul, Maha Yogaraj Gugul, Lakshadi Gugul. These types of Gugul are these are the drugs present described in the Ayurveda, which can be given in this osteoarthritis very effectively. Then Kamduda, Praval, Panchamru, these are the drugs which also given. Then Gandhatel should be given in the oral form also. That is, the capsules are present, and capsule should be given so that Gandhatel also allows, or it is very effective in the degenerative condition of the osteoarthritis. So these types of the treatment is described in Ayurveda according to the various stages of the diseases. Not every treatment is given at a time, but as the disease progresses or as the conditions are changing, then different types of upakarma or procedures are added or given in that case also. So thank you. This is all like about the Sandhigat Vata according to the Ayurvedic perspective. Thank you, madam.
Thank you so much, sir. Hetu, Samprapti, Chikitsa, very well taken, sir. And Basti is the main treatment for Sandhigat Vata or osteoarthritis. This is from Ayurveda. Now, expert opinion from Unani. For expert opinion from Unani, I would like to request Dr. S. Muhammad Akram. He is assistant professor from MTC Malegaon, Nashik. Dr. Akram. Okay, I think he is not there. So we will take next opinion from homeopath. For homeopathic expert opinion, I would like to request Dr. Parth Roy. Dr. Parth Roy. He is professor, organon of medicine, Shri Bhagwan Homeopathic Medical College, Aurangabad.
Good afternoon.
Good afternoon, sir.
Yes, good afternoon, madam. So I took the upper hand because the student who presented the case, he was from my branch only.
Yes, sir.
So fantastically, everything is explained. Especially, I would like to thank the Ayush Department of Maharashtra University of Health Science for giving me a chance to talk in this case presentation. Kalyankar madam told every detail of a joint. It was exactly as we are visualizing knee joint. Thank you so much, madam. And really, when we speak about this osteoarthritis, so it's a very common disease occurring to the ladies, even for the males, and for the age group, everything is fixed. And when we speak osteoarthritis from a homeopathic perspective, because as we all know, Ayush is a branch where we, all the people who believes on holistic mode of treatment, that means considering the patient as a whole, not the part is sick, but the whole is sick. So it was the behind concept of everything. So the girl who had, our student who had taken the case, so she had tried to incorporate many things. Not only her thought was restricted on the joint problem, but it was covering the patient's psychological aspect as well as the physical aspect, his physical desires, his physical aversions, what he likes, what he doesn't like. Even his background, he was a retired police officer, and how much he was crucial in doing his duties. Why she has taken all this thing? Because being a teacher of hers, though she is belonging to different college, so in front of the august audience, I want to mention, because we want to survey the patient from all the aspects, we try to find a drug that can cover the patient. So it's a process of matching the symptom of the patient and the symptoms are written in our book, what we call homeopathic materia medica. Now, what is the homeopathic materia medica? So it was, we all know that homeopathy was initiated by a German physician. His name was Christian Frederick Samuel Hahnemann, and he was an allopathic physician of his days. He became discontent and he brought homeopathy in practice. A process he involved. What was that? He used to give the drug to a patient who is not having a disease. And for a span of time, This drug used to be given to him, and he used to develop some symptoms that is of that drug, and he had written it. And it is not a story of 2,200 years back. Still the process is going in different orders of this world. So it is called a process of drug. So in this drug proving, we found both. A person has got some physical thing, a person has got some mental thing. And later on, Hahnemann proceeded further that how many diseases we can name, because diseases are 1,000. So he categorized the disease in basic three things. One thing, a process of inflammation. Any process of inflammation, because at any initiation of the disease, there is a process of inflammation. Now, this inflammation we may perceive, we may not perceive. So, for example, acute coryza, we can perceive, yes, there is inflammation. I have got some headache, I have got some red eyes, I have got some nosy, I have turned to be nosy. But in cases of deeper diseases, say malignancy, cancers, we may not feel this inflammation. So that is occurring inside, and suddenly it is coming out of the breast. So when we say cancer, the cancer is already established in the body, and then we are just giving the symptoms of cancer. If the patient is lucky enough, it is accidentally diagnosed in the first stage, so that is curable, and following that, gradually chance of recovery getting less. So Hahnemann categorized this. The disease will be in form of deposition, that something should be deposited. Deposition may be in terms of growth also, say tumor. For example, deposition, say arteriosclerotic changes. So deposition, gout. Because there we are saying something is getting deposited. He put all the disease, ultimate having a pathology of deposition, each psychotic. And where we are getting any degeneration, that is our topic today. This is DJD, degenerative joint disorder. As Madam directly pointed out, it is not inflammation, it is degeneration. And degeneration going to sclerosis. The cells and tissues are dying. Quite naturally, there is some inflammatory changes taking place. The movement is getting restricted, just like Dr. Swami sir was telling, the color, dolor, and etc. etc. So there is a restriction of movement. And gradually, the restriction of movement proceeded to that level, the person cannot walk, the person cannot even bend his legs. So, from a homeopathic perspective, this is a syphilitic stage, as Hahnemann suggested. So, there is a formation, there is a destruction, following that there is a formation. So, quite naturally, this, from a homeopathic understanding, the causation will be psychosyphilitic. So it is syphilitic in origin. Gradually, it is going to produce a psychotic stage. So what the patient, our student have presented, the person has got tremendous, you see, he is too much time bound, he is too much duty bound. He likes telling truth, positives. So this is supplying that thing. This is supporting his psychosyphilitic background. Now, what the medicine he had given, I do not know. But as far as the treatment procedure are concerned, so we are getting two stages. One, the person having initial stage of this ankylosis or the stiffness or pain. And now the patient is suffering with pain, and the pain is acute. And second, the person is having pain, but that is not so severe, there is a process. So that a physician has to evaluate what the physician or the patient needs from us. Whether the patient is asking, doctor, there is tremendous swelling, or if it is not swelling, I cannot even sit to my commode. I cannot sit to my ground. So this case is entirely different, where the person is telling, I have got a pain, that pain is aggravated. After heavy work, the pain is aggravated due to some atmospheric changes, say rainy season, say when there is cloud, so I get aggravation of pain. I have got pain aggravated during time of full moon or new moon. So that everything is to be considered. So cases are getting two. One, where we are getting acute pain. And second, when we are getting a chronic pain. So I have to decide what I have to do now. Whether I should go for a constitutional treatment, because in constitutional treatment, our target is not reducing pain. Our target is to providing such strength to the patient that the patient can overcome pain. And when the patient is seeking for this, my pain at first get to be reduced because my daily work has been stopped. I cannot stand, I cannot walk, I cannot ascending stairs, because these are the problems to which the patient comes to us. So from a psychosocial background, as per as a constitutional treatment, because that is varies to each other, but still I must say, aurum metallicum is a fantastic remedy that is given constitutionally, because in aurum they have got a strong affection on the bone, it is syphilitic. And that is a syphilitic remedy, and from modern concept it is cancerous remedy. Another new remedy came, that is osteoarthritis nusod. This is given as an intercurrent. What Madam was telling, that is very interesting, that a person or ladies, they are suffering. Whether ladies' hormone has got some role that actually doing some massacre to the joint. The ladies taking oral contraceptive pills, whether they have got any problem. Because in many occasions, for my personal practice, I have used estrogen in a higher potency that smoother the process of treatment. Many new remedies, say Bauselia serrata, a strong remedy in mother tinctosis, the relief spray, Harpacophyta, curcuma longa basically is prepared from haldi, tremendously goodly working on that, beautifully working for relieving acute pain. I'm talking about the severe pain. Another remedy, that is equisetum. We know Equisetum hyemale, that is a remedy for urinary. Another variety, Equisetum aeravens, you can use it. That tremendously quickly reduce the pain. The medical drug, say whether the patient is problem on ascending, ledum, whether the problem has got a pain in descending, calmia, whether the patient is having pain on right knee Monday and left knee on Tuesday, calmia again. When the patient is having pain, when there is cloud, rhododendron. Whether the patient is having pain but having some bleeding episode, go for, again, for example, Melilotus alba. Whether the patient is having pain and that is relieved by putting the leg up, lifted up, the drug is Phytolocca. So, it is called homeopathic therapeutics by which we are managing the cases every day. Now, many remedies, for example, benzoic acid, whether the patient having pain with urinary symptoms or the problem patient having strong urinary smell, yes, so the drug is again benzoic acetone. Whether the patient has got oncological dispute, one drug that is Hura. Hura is basically a gum. So the doctrine of analogy comes as term sticks. So our psychological symptoms, it is how much beautiful it is. There is a fear or the problem starts from separation. Suddenly the old man feels his son is not staying with him. So quite naturally this person needs such kind of deep degree drug, that is true. Another drug, that is Angostura. For example, the drug Asafoetida, Quiacum. These are the fantastically active drugs. Because the time is short, because after me, there are a number of people to speak. So, these are the etiological concept. These are the therapeutic concept. The diagnostic method is similar as the world uses. Go for a X-ray. And the girl is also our student, beautifully presented it also. And last but never the least, when the time to refer. Now, replacement of the knee. That is not easy thing and that cannot be achieved by many people in SAP. It is not so much cost effective also. So physiotherapy, along with this, as Swami sir was telling, applying some Narayan Tailo and etc. etc. So this really gives good result to this patient. So with this, I'm closing my words because still some people are waiting and the time is getting less. So I'm again thankful to all the people and especially Nashik University to give me a chance to talk in front of such august audience. Thank you. Thank you so much.
Thank you so much, sir. Thank you so much for your holistic approach for osteoarthritis. Thank you.
Thank you.
The next expert opinion from Unani stream, I would like to request Dr. S. Muhammad Akram, Maligaon. Dr. Akram, please unmute yourself. You are there in meeting, but you are not audible. Dr. Akram. Okay, so now I'm audible to all. Yeah, I'm audible. So from next time, we will start respiratory system, and for that, I will request all PGs, please send us case scenarios from respiratory systems, and then we will start the cases of respiratory system. So it's all for today, and thank you so much to all audience, all participants for your active participation. There is a feedback form, and I hope that you have filled up. If not, please send that fill-up form, that feedback form to us. Thank you so much. Have a nice time.